Gentleman right here. Oh, no, wait, that wasn't fair. Now, I said boy, girl, boy, girl. The boy raised his hand. Now, I gotta admit that, are you her husband?
Yeah, he has one to reach, so.
I see, okay. All right, I got
Okay, the question.
I give you credit for being good to your wife.
Oh. The question that I have is this. When you take office in January as the next president, you are inheriting a mess. I mean, everything from economics to our infrastructure to our the way that the world views us, you're inheriting a big challenge. And what can you say? Now, I have the patience. I have 3 teenagers, so I'm patient. But what can you say to the American people to make sure that we have the patience to give you a chance to do the job that you have?
Well, I think it's a great point. Look, I've got tons of ideas about what I intend to do, but we're not going to be able to do them all at once. I mean, most presidents, if they get 1 or 2 big things done a year, they're doing a good job. Because this is a big, complicated country. But let me tell you what I can do immediately. I mentioned the whole issue of reviewing executive orders around civil liberties. That's something I can do immediately. But what I can also do is have all of our agencies, my cabinet members, reviewing a lot of the changes that have been done by this administration that have been harmful were done by executive order. So we can, if you've got a bunch of labor laws, we got some unions in the House. There's so many laws by the Department of Labor that have made it harder to organize, harder to collectively bargain. Those don't require new laws, it just requires that the Department of Labor actually believes in labor. And that's some of the things that we can do right away. In the Environmental Protection Agency, many of the interpretations of regulations and laws have been tilted to advantage polluters. We can reverse those immediately without passing new laws. So there are a number of things that we can do right away that will make a difference in people's lives, even though it's not a big new government program. What I will focus on, my first, people always ask me, what are the first 3 things you're going to focus on? I want to be clear about this. Number 1, I will call in the Joint Chiefs of Staff and tell them they have a new mission, and that is to bring an end to this war in Iraq in a responsible way. Kathy and I were talking, Kathy who introduced me, she and I were talking earlier, and she was saying a lot of her friends come up and say, well, wouldn't it be a disaster if we just pull all our troops out immediately? Well, nobody's talking about an immediate pull out. We're talking about immediately beginning to withdraw, but we would do it at a careful pace of 1 to 2 brigades per month. At that pace, it would take anywhere from a year to 16 months, depending on how many troops are there, to have all the combat troops out. And that means that's 2 years away from now. So that gives the Iraqis enough time to do what they should be doing, which is negotiating the kind of settlements and stabilization that includes sharing oil revenues, that includes sharing power between the various ethnic groups. So that's first thing I want to do. Second thing I want to do is to bring Democrats and Republicans together around health care reform. And this is something that is long overdue. We've been talking about it for decades now. The reason it hasn't happened is because you've got insurance and drug companies and HMOs writing our health care laws, and that has to end. So the plan that I've got is to make sure that every single American can buy into a government plan if they want to. They won't have to. If they want to keep their private insurance, they will keep their private insurance. And as I said, we'll work with employers to set up what's called a catastrophic reinsurance plan, that levels out premiums so that the average family can save about $2,500 per family per year. But if you don't have health care, if you're self-employed, so many people I meet, self-employed, underinsured, their premiums are so high that they never have regular checkups. You can buy a plan similar to the one I have. It will emphasize prevention, because right now what we don't have a health care system, we have a disease care system. We wait until people are really sick and then we intervene. So what we want to do is spend more time providing, regular checkups, reducing obesity levels, helping children with asthma so that they are not having constant attacks and having to go to the emergency room. We have to negotiate with the drug companies for the cheapest available price on drugs. Too many of our seniors are still struggling with the cost of prescription drugs because Congress did not allow Medicare to negotiate for the cheapest available price on drugs. So we're still paying twice as much as they pay in Canada, twice as much as the VA pays for drugs. So that's going to be the second priority. The third priority is going to be the energy plan that I just talked about. If we do those three things, stabilize the situation with respect to the war, and by the way, that means also refocusing our attention on Afghanistan. Getting our healthcare system working so that it's not only making people healthier, but it's no longer an economic drain on families and businesses. And get our energy policies under control. If we can get those things done, then that will also free up money that will allow us to do the other things that have to be done, like education, college scholarships, making college more affordable, investing in infrastructure. That's where the money comes from to get all those things done. If we don't take care of those three things, if we don't take care of healthcare, we don't take care of energy, and we don't deal with the war, we won't be able to afford any of the other initiatives that we're talking about, because we will be broke. And the Chinese at some point will stop lending to us, and then we're really going to have problems. All right.